in distress. So you can't go by that. So those are our biggest physical deterioration. Okay. Having a problem with drugs and alcohol, is that going to affect children and parenting? Is that going to affect relationships? Of course it will. Does it affect your mental wellness and your stability? Depression, anxiety is synonymous with, because you're drinking a central nervous system depressant. So of course it's going to cause depression and anxiety. That's its job. That's going to affect all kinds of areas. So it's going to deteriorate you in all ways. Does being an alcoholic or a drug addict, is that going to help with your productivity? Is that going to help with your motivation? Is that going to help? Of course not. Does it help you think better? No, it destroys short-term memory and problem solving. It deteriorates the process, the neurochemistry in your brain. And how is that going to make it better? It's not. It's going to make it worse, to the point where you're unemployable and on disability. The vast majority of people on disability are diagnosed with substance abuse and mental health issues. The vast, vast majority. I think it's like 60 or 70%. Wouldn't it be nice to take that 60 or 70% of people that are unable to work and drawing money and draining society and put them back to work and be productive and have dignity and have prosperity in their life and have families and have self-esteem and self-worth? I think that would be great. I don't want someone to be in a situation where they deteriorate to the point where they can't be functional anymore. That's horrifying. Nobody should want that. Nobody should accept that for something that we can control. A lot of times people say, well, Dr. Anderson, it's not a choice, it's a disease. That's a lie. Anybody who says alcoholism or addiction is a disease is ignorant. They're ignorant because it's a disease model. It's a disease model to help, that we formulate a disease model so that we could treat it. We could have symptoms, etiology, epidemiology, treatment, and prognosis. That's a disease model. It's not a disease. There's no genetic anomalies that cause addiction. If that were true, nobody would get better. And many people get better. A majority of people get better. So are there genetic predispositions? Absolutely. That's different than a genetic disorder. But it is not a medical or a disease. It's not a disease. It's a choice. And you say, well, it's not a choice. When I have cravings and urges, you don't have to drink. That is a choice. It's a hard one. But let's go back before then, before you were out of control, before it was conditioned to the point of being part of your parasympathetic nervous system, which makes it very hard to control. Before that, it was a decision. Because when you were getting drunk, when you first started drinking, people were saying, listen, you better stop or that's going to turn into something you don't want. And you ignored them. Isn't that a choice to ignore them? Isn't that a choice to continue to abuse it over and over again? You have to abuse alcohol thousands of times before it becomes habitual to the point of creating addiction. So weren't those thousands of times decisions? Your choices? You chose to do it because you didn't care about the consequences. That's a choice. Nobody forced you to do that. But now you're going to say it's a disease and that you don't have a choice once you feel out of control? Wow, how convenient that is. I guess that negates you from any responsibility of getting better, right? Because if you don't have control over something, certainly you can't do anything about it and it's not your fault. What a bunch of garbage. I don't accept that. You do have a choice. And a lot of people that have suffered with addiction are better now for life because they chose not to do it anymore. And you have to go through a process. You have to go through a process, but it's all choices. Every single thing you do is a choice, everything. And if you make enough good choices, you won't suffer with addiction anymore. You'll be able to overcome it and you'll have a good life. So that victimhood, get off it. It's no place to live. It's a dead end. So you got to take responsibility for yourself, which is what we said at the beginning.